So the CU that we are going to do today is on ethics, and we're going to talk about ethics and how to the ethical considerations while working with older people, like older clients which have developmental disabilities, autism, and things like that. So first of all, the thing that we want to talk about, there's a little video that I want to show you that why is ABA controversial. So ABA is already very controversial, and we have to make our, we have to get in a way that, just give me 1 second. Like, we are already controversial, and we want to make sure that what we are doing is good. And so now what we have to do is that we have to figure out that how we can make things better and for us in the field of ABA, and then how do we follow ethics and ethical guidelines to work with those clients who have disability that are like clients with intellectual disability, clients with developmental disability, all those clients that are like older clients. But you also have to understand that there is a lot of pushback towards ABA in the field. So Dr. Mary Barbara over here, she talks about that. So let's listen to what she's saying, and then we'll go further.
And today, why is ABA so controversial? I get this question all the time, and I today am going to tackle this question from a different perspective. I am going to show you a clip from an interview that I did with Armando Bernal, who was diagnosed with autism at the age of 3, and he was pretty significantly impaired. And now he's an adult autistic person who is also a board certified behavior analyst. And we talk all about the controversy of ABA. Let's get to it. Hi there, I'm Dr. Mary Barbera, and if you haven't been following me, I've been presenting YouTube videos for over 5 years, and I also have been creating weekly podcasts, video podcasts, for the past 3 years as well. In the past, I've presented weekly video blogs and kind of fallen out of that a little bit, so we're going to try to resume by presenting not the whole podcast necessarily, but a chunk of the podcast, the video podcast, so that we can cover specific topics to help you quicker, and you can share it, you can watch it, and we can point people back when they have questions about related topics. So today we are covering the controversy of ABA with an interview from an autistic BCBA. Before I get to that, if you haven't subscribed to my YouTube channel, you should do that now, because I just got a plaque that says I surpassed 100,000 subscribers here on YouTube. So thank you if you're one of those 100,000. If you're not, you can subscribe now and hit the notification bell too. So let's get to this short excerpt from podcast number 151 with Armando Bernal, talking about his background as an autistic child, an autistic adult, and then when he found out about ABA after he became a special education teacher.
I started doing mentoring programs in college for children with autism. I was like, wow, I love this. This is awesome. And again, I didn't know what to think of my own autism. And so seeing so many children in this mentoring that needed support, I was like, this is a great opportunity. So I got into special education. I became a teacher in that sense. And then as I became a teacher, I realized I did not know what I was doing in a sense where I was a first year teacher. This was a lot. There was, aggression. There was different behaviors that were being shown. And I didn't really have a whole lot of understanding on how to handle it. And my sister, who had done it for some time, helped me a lot. but I always felt in myself that there had to be more to help with these kids. There had to be something to do, and I did some more research, and then that's how I found ABA. I didn't even know it existed until I was able to start doing more research. I found podcasts, I found different kinds of YouTube videos and things like that that explained it a bit more, and I became really fascinated on the fact that a typical ABA thing is that there is 4 reasons why people do anything, you know, escape, attention, sensory, or they want something. And I was like, wow, that's so simplistic. There's so, you know, it's very black and white. And for me, I've always seen the world more as in a black and white, like it's either this or this. And that just helped me understand so much. And I was so drawn to it. And I just told my sister after, I was like, I'm going to get a master's in this. And that's just how I've always been. And she's okay, I believe you. And so I went and I did it. And I passed.
Is that something you disclose right away to the parents of the kids you're helping? And like, how did that kind of letting people know and disclosing the fact that you have autism, when did it start, and what's it like now?
Oh my gosh, yeah, no, I love that question, because it's from the people that I've interviewed as well, like there was so much time that I've had that I wish I could go back and say, hey, I had autism. But again, like I was saying, in the 90s and early 2000s, that wasn't the case. That wasn't something that you really wanted to disclose unless you wanted to be looked upon differently. And I didn't. And it wasn't until actually I graduated college that I realized that I need to be more accepting of who I am. And it was because of the parents that I met while I was in special education. It was because of the experiences I had that really let me understand that I needed to be who I am in order to better serve the kids that I see now. And one part of your question was, do I tell parents? More often than not, I don't. And it's not so much that I am ashamed, it's because it's not my story that they're interested in when they come to me in the clinic or when they come to me in a special education setting. It's the parent who has really swallowed a lot of pride to say, hey, I need help. And that's, for me personally, I feel like that's so hard for parents to accept. And I want to be able to show them that they are able to do so many great things. And so I focus on their child's story. I focus on their wants and needs because that is what matters. There are some occasions where a parent just comes to me and is really down and out about their child's situation. So many times I can't tell you that I've heard parents say, my child has autism, I think his life is over. And that's really when I try and step in, when I see these parents are upset, they're frustrated. And I tell them that that's, you know, that doesn't need to be the case. And then I disclose my own story to them to let them know that if I can do this hard thing, then I'm here to support their child and do their hard thing. And that more often than not, thankfully, has been a sense of hope for the parents to say, I can do this, I can accept it. Because sometimes parents come to us in the clinical setting or in a school setting and say that they don't want to do ABA because they've heard so many horror stories of what ABA can cause. And I try to bring in my side of the story to let them know that that's not the case here, is that they're here to progress, they're here to grow in independence, and that's my main goal.
Mm-hmm. Yeah, as a BCBA, I've done a lot of podcasts on ABA, for myths and truths, how to spot good ABA. We just had Tamika Meadows on from I Love ABA. We can link these in the show notes, but increasingly, you know, now that insurance is covering all 50 states, there's more access than ever. And now we have lots of people saying ABA is abuse and you shouldn't try to change things. And, you know, autism is a gift. And like, so you're kind of caught in the middle of this firestorm, right? So like, how do you respond if you get adult autistics that come and say, how can you be a BCBA? That's abuse.
I've gotten that plenty of times, actually. And I enjoy the fact that I get to be in this middle ground, because it is so much controversy on both sides, right? Of ABA is abuse, ABA is not abuse, and it's just back and forth. But I get to hopefully bridge that confusion, or I get to bridge that conflict and tell them that this is why I'm in this field. This is why I've seen this progress, because it's for, I do what I do because it's for the parents that come to me and say, my child hasn't eaten anything but chips and snack foods for 7 years. Or my child has never said, I love you, or gone to the bathroom by themselves. And to see the success and the growth in that child after ABA, for them to be able to eat all kinds of foods or be able to go to the bathroom and take care of independent skills like that, is why I do what I do. And so I tell a lot of parents that come to me, like I was saying, that come to and say, oh, I can't do ABA, that is one bad apple in a whole bunch that unfortunately causes these conflicts to arise. But that's not what they're going to get when I help them. And I try to be as very transparent as possible and say, please, view what I'm doing, see what I'm doing in this clinic, and you're welcome to come at any time. I always try to make sure that it's a partnership. And the same thing with those individuals with autism that say, like, how can you do ABA? And I say, please give me your evidence. And just like any good BCBA, let me see the evidence-based articles that you're describing to me, and we can talk about it. And I can give you mine, and we can have a back and forth conversation. And sometimes they agree, and I love that, because I can talk ABA all day. But other times they don't, and they say, no, I don't want to listen. And it's like, okay, well, that's the problem then. If you're not willing to hear one side or the other, then this isn't going to go anywhere. And I continually invite other people to come find me and say, like, this is why I think what you're doing is wrong. That's fine. Let's have a conversation and talk about it.
I hope you enjoyed that short clip from Armando.
Okay. So I just wanted to show you this clip because ethics plays a very, very important role in when we are working with kids and adults who have developmental disabilities, autism, any kind of special needs. And now, as the time is going by, we are hiring more and more people that have had any kind of disability. So even, like, you have to be an advocate for those kids, those adults who have special needs or any kind of disability. So I have, in Pakistan at bases, we have 2 people who have developmental disabilities, but they are working at the clinical setting. And here in Chicago at ours, I have 2 RBTs who have autism spectrum disorder, and they are working as RBTs in our clinical setting. Those are the best advocates for ABA. So why is ethics important, and why do we have to be ethical in the work that we do, so that we are a good role model for the people that we work with, right? So if we are going to work ethically with our clients, with our adults, we are a good role model for them. And once we are a good role model for them, then what we are going to see is that the other people are going to reciprocate it, and they are going to take it further in their field. And when we are a good role model, we are going to prepare better people for the society that they're living in, and also for the families, because some of the families, they are horrified right now with ABA, and they said that ABA is not something good for their children. ABA is something that is bad. ABA is something that is very cruel, and that's the thought that we want to take away from everybody, and we want to bring in newer thoughts and newer views about ABA. So therefore, ABA and ethics is very important. And as you all have gone through ABA, we have to look at things with the lens of how ethical can we be when we are working with adults. So how many of you in this group are working with adults right now? Is there anybody who's working with adults in the field? Okay.
No, ma'am.
Okay. So when you're working, let me tell you how it looks like. So when you're working with adults, what we do over here is that we have a day program for them. So in the morning, they go to the day program. They go over there, they have different activities over there. And then in the evening, they come back to their houses, to their sillas. And in the sillas, they are, working, like they eat, they sleep, they do their, they watch TV, they listen to music, they go into their rooms, or they're staying with their parents and caregivers. The issue is that as a behavior analyst, when you're working with them, first of all, you have to work in your own competencies, which means that if you're competent enough to work with them, then you should work with them. And there are going to be all kinds of issues that come with them. There are going to be behavioral issues that come with those clients. There are going to be, issues of like their development, like, how their body is developing, what are their issues that are happening, hormonal issues, other issues that are happening, that you have to deal with. And are you comfortable to work with those issues, right? So when you're talking about these ethical considerations, what you look at is that behaviors, practices, and decisions that address three fundamental questions. What is the right thing to do? So when you're working with adult clients, you have to see that what is the right thing to do when you work with those clients. If you're working with an adult and you see that they are having issues with like sexual issues, or they're having issues with they're hoarding things, or you have issues with self-injurious behaviors, in that situation, you are supposed to see that what is the right thing to do in this situation? Like, how can you make the situation better for this client? Like, what are you going to do? Like, are you going to just, like, if you see a problem, for example, there was a client that we had in Karachi, and what the therapist told me is that, ma'am, he got suspended from school. And I said, why did he get suspended from school? And she said that the teacher is saying that he is trying to masturbate again and again, and I said, and then, she said that although they have not seen that behavior at home, but they are suspending him and they're asking the parents to look into that issue. And once we kind of looked into it and we researched that situation, what we found out was that that child, that adult, he was like 17, but he didn't have an issue with like a sexual behavior. It was because he wasn't potty trained and he couldn't use the bathroom, so he was on a diaper, right? So he was on a pull-up, and that pull-up, because it was getting hot and heat, because of the heat, he would get rashes and he would itch himself, and because of that, people thought that he's having some kind of a sexual activity, and as a result of that, they didn't understand his problem and they suspended him. So this goes against our ethics. Ethically, we cannot do that. Ethically, we are supposed to do what is right for the client. We have to do a functional behavioral assessment. We have to come up with what is the function of his behavior, and that's where we find out if it is for the tangible item, if it is avoidance, if it is escape, if it is physical, or if it is attention based. And then once we find that out, after that, we can come up with a solution for that client, right? And what is worth doing? So, in these situations, what is something that is worth doing? Like, what should we do? Should we like talk to the parents? Should we be an advocate? Should we talk to the schools? Should we educate them about it? So like, for example, if they don't know anything, if they don't know what is happening, if they don't know how to deal with it, then you have to educate them. So I'm going to give you another example. This was in 2017 when I was doing some RBT trainings in Pakistan. One of the persons approached me and said that, ma'am, you always talk about little kids and small kids, but can you please do a seminar on stereotypic and sexual behaviors for kids that are adults and who have autism? And I was like, okay, I'll do it, but I don't guarantee that I am going to be able to come back to Pakistan after this seminar, because I don't know what the Maulvis are going to say after they see my post, because it was going to go on live. And so I did do it, and we did it in collaboration with the staff from it was Head Start, Kuri campus. One of their special needs school, I don't remember the name of it, but we did it in collaboration with them. And when I started that seminar, we had almost 40 parents that showed up to that seminar, because they do not know how to deal with kids when they're growing up. And nobody is there to show them the path or the way to work with kids when they're going through hormonal changes, when their bodies are changing, when they're growing up. Sometimes, people would just slap them, hit them, close them in the rooms, tell them, no, this is not appropriate, and just shove it under the rug, or take them to the Maulvi for them, or just say that अच्छा इसका exorcism कर देते हैं, या इसको जो है वो ठंडी चीजें पिलाओ, things like that. So these are all like myths and misconceptions that people do. But when you are ethical, you have to look into those problems and you have to find solutions for them. और उसमें फिर आपको parents को educate करना है. You have to educate the parents that this is something that is always going to be there and you just have to work on it. उसमें फिर कई दफा ये होता है कि you talk to the parents, you become an advocate for the child, you go, you see doctors, you see medical professionals, you seek that help. Sometimes, you're able to get some medications to help them. Sometimes, you have to give them that private space so that they can go to the bathroom, they can have their private space, then you can have social stories for them, and you have to work on it because it's not something that is just going to go away, right? It's something that a child is born with, and this is something that's going to be there. So these are issues that you have to look into. Now, when I'm in America over here, at the first time I became a behavior analyst, 2014, I got a job. I was working 2 jobs. So I was working in the morning with adults, and in the evening, I was working with little kids. So in the morning agency, my boss, his name was Pat, he's like, Juhi, you have to work with this kid who's 20 years old, and he is dating, so we have to go over like a whole sexual education curriculum with him. Would you be able to do it? And he asked me, he said, are you comfortable? And I wasn't comfortable because that was my first time. I had never done it before, and then culturally, the background I belong from, it was very hard for me to work with it. So I said, no, Pat, I can't. And so Pat said, don't worry about it. Let's go upstairs. You can sit outside the room. So they had a room where they had a glass. And he said, sit on the other side and just watch me doing it. So he did it. And then after that, I watched him, I observed him. And now if you ask me to teach a sexual curriculum, I can teach it like this. That's not an issue. Because once you're a behavior analyst, you have to leave everything behind. You have to leave your religion behind, your culture behind, your prior training behind, and you have to work for the betterment of the clients that you are working with. So you cannot let any of your biases, your culture, your religion come into it. And if you are uncomfortable and if you think that you cannot do it, then don't take that case. But make sure if you're working with adults, you want to make sure that you're helping them, supporting them, and you're giving them that space and time to, exercise their adulthood. Okay. So what is the end goal that all behavior analysts and all behavior therapists have to follow? The end goal is to further the welfare of the clients. So basically, we are supposed to further the welfare of the clients, and we're supposed to see that what is beneficial for them, what is good for them, and like what is the best outcome that can we do for them, right? Like suppose if there's a client who is hitting themselves, why is he hitting themselves? Because he's if he keeps on hitting, he's going to harm his face, he can have contusions, he can have concussions, also he can harm himself really badly. So in that situation, what is the best thing to do, and how can we further the welfare of that client? So in that situation, ethically, you're supposed to do a functional behavioral assessment, and you do not refer the patients or the parents out for immediate medication, right? Because this is what we do. हमें डर लगना शुरू हो जाता है जब हम बड़े बच्चों के साथ काम कर रहे होते हैं और हम कहते हैं कि ये हमें कहीं मार ना दे या कोई हमें कुछ कर ना दे, तो हम जो है ना क्या करते हैं कि हम उसको दवाई दे दें बस. let's give this kid medication because we cannot handle them. सबसे पहले जब आप बड़े बच्चों के साथ काम कर रहे हैं तो आपको एक ट्रेनिंग लेनी है सेफ्टी केयर की, जिसमें कि आपको ये पता चलेगा कि फिजिकल मैनेजमेंट आपने बच्चों की किस तरह से करनी है, खास तौर पे उन बच्चों की जो कि बड़े हो रहे हैं, खास तौर पे उन बच्चों की जिनमें बहुत ज्यादा पावर है, एंड यू कैन नॉट like you'll get hurt if you're working with them. So take physical management trainings, they are called as safety care trainings, and after that you have to work on how you can safely work with those kids, right? अच्छा, उसके बाद आपने जब उनके साथ काम करना है, आपको डर अपने अंदर से निकाल देना है, because if you're going to be scared, if you're going to be anxious, you can't work with them. And then after that you have to work with them in such a manner कि आप उनका पहले functional behavioral assessment करें, उसके बाद आप behavior analytic चीजें जो है वो अपने जो कुछ आपने सीखा है, you bring that into therapy with them, right? So you make a behavior plan for them and then you work with them. So I'm going to give you another example. Abhi recently we started with a kid, ठीक है? अभी जब हमने शुरू में उसकी असेसमेंट की तो सबने मुझे कहा कि there's the mom said, oh he's fine, बिल्कुल अच्छा है, कुछ नहीं करता, बिल्कुल तंग नहीं करता, सब कुछ. And you know, I said okay, that's fine. So I sent my assistant behavior analyst to go and work with them. And she said, oh everything was fine, everything बहुत अच्छा रहा. मैंने कहा ठीक है. So the therapist went there the next day, and the third day the therapist quit. And when I found out that the therapist quit, I called her and I said, what happened? And she said, they started headbanging, और उनकी headbanging इतनी बुरी थी कि उनके खून निकलना शुरू हो गया, and we couldn't bring them inside. And I was like, well, that's my fault because I should have picked this up before. So this is my fault. So then what I did is I talked to the therapist and I told them that you guys need more training. So I retrained them. I went back, I re-observed us client ko, he was 18 years of age. We made a behavior plan for them. The behavior was topographically defined. So you have to define the behavior topographically. और फिर उसके ऊपर हमने रिसर्च की, हमने आर्टिकल्स फाइंड आउट किए कि व्हाट आर द थिंग्स दैट वी कैन डू फॉर सेल्फ इंजूरियस बिहेवियर्स. और उसके बाद हमने उसका एक प्रॉपर बिहेवियर प्लान बनाया, और बिहेवियर प्लान बनाने के बाद उसके अंदर हमने सब कुछ लिखा कि अगर ये हो तो आपने क्या करना है, ये तो आपने क्या करना है. So this is the ethical way of working with the kids. अब suppose I have another client who is of 17 years of age. उसका प्रॉब्लम यह है कि उसमें बहुत ज्यादा OCD behaviors हैं, ritualistic behaviors हैं, और उसकी वजह से अगर आप किसी तरह से like he's so powerful कि अगर आप उसको रोकें तो क्या होता है कि वो बजाय इसके कि he gets more aggressive and he starts hitting you. So that is a dangerous situation. In that situation, what I have done is I did take the help of a psychiatrist, and I did talk to a psychiatrist, and I told the mom that we have to go to a psychiatrist. So the psychiatrist did prescribe him a very small dose of medication to take the edge off. तो अब उससे ये होता है कि थोड़ा सा वो काम है, थोड़ी हम behavior therapy कर रहे हैं, he's getting better. What my end goal is कि he should be medication free. ठीक है, तो आहिस्ता आहिस्ता वो इतना बेहतर हो जाए कि मेडिसिन उसकी हम खत्म करा दें और बिहेवियर थेरेपी से ही हम उसके बिहेवियर्स जो हैं उनको मेंटेन करें. सो हमारा जो एंड गोल है वो ये होता है कि वी हैव टू फर्दर द वेलफेयर ऑफ आवर क्लाइंट्स, क्योंकि जितनी भी ये मेडिकेशंस हैं जो कि आपकी हैं psychotropic medications हैं, they have a lot of side effects, and because of these side effects what's going to happen is that you're going to see that उसके टिक्स आ जाएंगे, टिक डिसऑर्डर आ जाएगा, कोई और प्रॉब्लम आपकी बॉडी में आ जाएगी, तो आप प्रोलॉन्ग्ड यूज जो है वो साइकोट्रोपिक ड्रग्स का नहीं कर सकते. आई वर्क विद अ किड हु वाज 22 years old, and his mom had him on 9 psychotropic medications. अब आप इमेजिन करो कि एक 20 साल का जो बच्चा है उसको उन्होंने 22 साल का बच्चा, उसको उन्होंने 9 साइकोट्रोपिक मेडिकेशंस पे रखा हुआ है. अगर उसी बच्चे को अभी वो जब 30 साल का होगा, 40 साल का होगा, तो उसको कितनी मेडिकेशन देने की जरूरत होगी, क्योंकि उसके बिहेवियर्स इतने स्ट्रांग थे. देयरफॉर एथिकली हमारा फर्ज बनता है कि हम सबसे पहले जो है बच्चों की थेरेपी, बच्चों की जो प्रॉब्लम्स हैं जिसमें कि उनके बिहेवियर प्रॉब्लम्स हैं, हम उनको हल करें ताकि जब वो बड़े हों तो उनको इतनी ज्यादा मेडिकेशन की जरूरत ना पड़े. और उसका नतीजा ये हुआ कि व्हेन ही बिकेम 23, उसका जो ब्लड का लेवल था, जो उसका था रेड ब्लड सेल्स, दे स्टार्टेड गोइंग डाउन, एंड ही गॉट टुरेट सिंड्रोम व्हिच इज the tick disorder. So he got the tick disorder, which was a side effect of the psychotropic medications. तो हमारा जो फर्ज बनता है वो यही है कि एथिकली हम बच्चे को जो है वो साइकोट्रोपिक मेडिकेशन से दूर रखें. अच्छा, नेक्स्ट थिंग जिसकी हमने बात करनी है वो ये है कि हमें जो है वी वांट टू मेक श्योर कि जो हमारे पर्सनल एक्सपीरियंसेस हैं, जो हमारे कल्चरल रिलीजियस बिलीव्स हैं, जो हमारी प्रोफेशनल ट्रेनिंग्स हैं, हम उनको they shouldn't become like a fog, like a smoke fog in our treatment. So basically हम सब different professional training से आए हैं. like आप लोगों में से कुछ जो हैं वो psychologists हैं, कुछ housewives हैं, कुछ special education करके आए हैं. लेकिन जब आप behavior therapist के तौर पे काम कर रहे हैं या behavior analyst के तौर पे काम कर रहे हैं, तो आपने सिर्फ और सिर्फ उसी के तौर पे काम करना है. You cannot work at another capacity, which means दैट आपने अपनी कोई भी जो पर्सनल एक्सपीरियंस है, जिस तरह से आप बड़े हुए हैं या आपके पेरेंट्स ने आपको बड़ा किया है, you cannot let that come in the way of your treatment. Your treatment has to be free of all of these things. Your treatment has to be it shouldn't be showing all of these things. Aapke, just agar suppose when I was little, my mom was very strict, but she would like beat me and like chappal se maar diya, kabhi kuch kar diya. But that's how my mom was. But this is not a suggestion that you can give to your clients' parents that, oh, agar ye aapki baat nahi sunta, aap isko mara kare. This is not something that we can do. So our personal experiences cannot come in the way of the treatment of our clients. अब cultural religious beliefs की मैं हमेशा बात करती हूँ कि whatever your cultural beliefs are, you cannot impose them on your client, and always make sure कि आपकी जो दूसरी professional trainings हैं, they shouldn't also come in the way. Secondly, जो चीज मैं हमेशा बात करती हूँ वो ये होती है कि हमारी जितनी भी treatment है ना, it should be socially valid. What is socially valid? Socially valid is that any treatment that you do has to be socially appropriate, and it should make the child feel like socially included in the society. So for example, agar ek bacha chota hai, when he is small and he's putting on like a diaper, it's okay, but we should try to potty train them. बजाय इसके कि अब एक 17 साल का, 18 साल का, 20, 21, 22, 23, 24 साल का जो बच्चा है वो डायपर जो है वो पहन रहा है, क्योंकि दैट इज अ सोशली इनअप्रोप्रिएट बिहेवियर. और उसमें फिर क्या होता है कि वो बच्चा जो है वो ही इज नॉट एक्सेप्टेबल बाय द सोसाइटी. आप मुझे बताएं कि कितने ऐसे लोग हैं जो कि बड़े बच्चे के डायपर्स जो है वो चेंज करना चाहेंगे. सो इसी तरह फीडिंग आ जाती है, टॉयलेटिंग आ जाती है, कपड़े बदलना आ जाता है, इस तरह की काफी चीजें हैं. सो यू वांट टू मेक श्योर दैट व्हेन यू आर वर्किंग विद दीज क्लाइंट्स, यू आर मेकिंग देम सोशली अप्रोप्रिएट, और आप जितनी भी ट्रीटमेंट्स कर रहे हैं वो सोशली वैलिड हो, यानी कि वो हमारी सोसाइटी भी एक्सेप्ट कर सके और उसके बाद हमारे जो क्लाइंट्स हैं उनको हम सोसाइटी में एक्सेप्टेबल बना सकें. राइट? So that is called as social validity. We also have to make sure that the goals should be acceptable for the planned behavior change. We also want to make sure that the procedures are aligned with the best treatment practices, and do the results show meaningful, significant and sustainable change. इसका मकसद ये है कि जितने भी procedures आप अपने clients के लिए use कर रहे हैं, for example over correction use कर रहे हैं या आप use कर रहे हैं response blocking, तो आपने ये make sure करना है कि जो उस बच्चे के parents हैं या जो उस बच्चे के caretakers हैं, are they okay with that treatment? जो प्रोसीजर्स हम, अगर सपोज आप उसी तरह से फॉर एग्जांपल सेक्सुअल बिहेवियर्स की बात करते हैं, तो अगर आप सपोज बच्चे को कोई प्रोसीजर सिखा रहे हैं तो क्या वो सोशली एक्सेप्टेबल है, क्या उसके पेरेंट्स जो हैं वो उसको एक्सेप्ट करेंगे? Do the results show meaningful, significant and sustainable change? और जो भी आप ट्रीटमेंट अपने क्लाइंट्स के साथ यूज कर रहे हैं, चाहे वो बड़े बच्चे हों चाहे वो छोटे बच्चे हों, they have to be sustainable. यानी कि ये ना हो कि आपने अभी उसको किया है और हफ्ते बाद वो ट्रीटमेंट खत्म हो जाए. It should last for a long period of time. और आपको कॉस्ट टू बेनिफिट रेशियो जो है उसको भी देखना होता है. ये ना हो कि आप बहुत ही कॉस्टली प्रोग्राम जो है वो एक बच्चे के लिए आप इम्प्लीमेंट कर दें और आपको बाद में पता चले कि इसकी जो वैल्यू है, सॉरी, इसकी जो वैल्यू है, just give me 1 second. This is my mom. Sorry. So sorry guys, I'm trying to. Okay. So you also want to make sure कि जो भी आप काम करें उसका एक लॉन्ग लास्टिंग इफेक्ट हो. कॉस्ट टू बेनिफिट रेशियो जो है वो भी हो, यानी कि उसमें कॉस्ट जो है वो आपके प्रोग्राम की ज्यादा ना हो, आपकी कॉस्ट जो है वो कम हो प्रोग्राम की, बेनिफिट जो है वो उसका बच्चे के ऊपर, क्लाइंट के ऊपर ज्यादा हो. सेकेंडली जो है ना, जब आप क्लाइंट्स के साथ बात कर रहे होते हैं या whenever you are treating your clients and especially your adult clients, you can never disrespect them. So you want to make sure that you are not disrespectful to them. You're always showing respect to them, and because they need the same kind of respect that you do for other clients, right? Or for other people, or for other adults. So never ever treat them with disrespect, because that disrespect is always going to come back to you. And also they have the right to humane treatment. They have the right to humane any kind of therapeutic treatment, therapeutic environment. So you want to make sure that you are always treating them with respect. Never be disrespectful to them. We also want to make sure that we have written guidelines or rules of practice that provide direction for the association or organization. So we also want to make sure that हमारी जो organizations हैं उनके कुछ rules और regulations. अगर आपका छोटा सा business भी है, even if you have a small business, there should always be some written rules and regulations for that, for your business. And you should follow those guidelines. And what जो सबसे गोल्डन रूल है आपके टू बिकम अ बिहेवियर एनालिस्ट और टू बिकम अ बिहेवियर थेरेपिस्ट, वो ये है कि यू ऑलवेज हैव टू फॉलो द गोल्डन रूल. एंड व्हाट इज द गोल्डन रूल? It is that you are self-regulating, that you regulate yourself and then calibrate decisions over time, which means that अगर आपको ये लग रहा है कि कोई ऐसी decision है जो कि आपने you took a decision which is not good, and it needs to be changed, so you can change that decision and you can put some other intervention in place. यानी कि आपने hard stone में नहीं सब कुछ लिख दिया कि भाई अब यही होना है, इसी तरह से हमने सब कुछ करना है. अगर आपने देखा कि बच्चे की जो needs हैं वो change हो रही हैं या adult clients की जो needs हैं वो change हो रही हैं, so then you also have to change the way that you're working with the client, because you want to make sure that you're providing them with the best services possible and you're providing them with the best care possible, right? So you have to provide them with the best appropriate care, and you also have to make sure that you are changing your decision with the changing needs of the client, and also you're taking into consideration the culture of the family, the religion of the family, and what do they want and what do they want from you. मेक श्योर कि आपके जितने प्लान्स हैं वो रिटर्न हो, खास तौर पे जब आप एडल्ट्स के साथ काम कर रहे हैं. अब हमारी जो बच्चियां हैं, जिस तरह से जिनको फॉर एग्जांपल दे आर गोइंग थ्रू हार्मोनल चेंजेस, उनको मेंस्ट्रुएशन हो जाती है, उसमें आपने किस तरह से उनके साथ काम करना है, कौन सी सोशल स्टोरीज यूज करनी है, किस तरह से फैमिली को ट्रेन करना है, ये सारी चीजें जो हैं वो आपके लिए बहुत इंपॉर्टेंट है. बिकॉज अनटिल एंड अनलेस यू ट्रेन द फैमिली, आप जाएंगे वहां पे काम करके आ जाएंगे, बट देन यू ऑल्सो हैव टू ट्रेन द फैमिली एट दिस पॉइंट. नाउ आई गॉट अ message from somebody in Peshawar, and they want to know about their daughter because now she's growing older and they don't know how to deal with her cycle. So that is something also that you guys have to look into. So उसके लिए सबसे बेहतर ये होता है कि आप रिसर्च करें, रिसर्च आर्टिकल्स को ढूंढें और उसके ऊपर काम करें, सोशल स्टोरीज बनाएं, विजुअल स्केड्यूल्स बनाएं, ताकि उनके लिए जो है ना आप बेस्ट से बेस्ट जो तरीका है ना वो कर सकें. ठीक है. उसके अलावा ये है कि अगर आपने जो है यू ऑलवेज हैव टू मेक श्योर दैट यू आर कॉम्पिटेंट, यानी कि आपके जो सर्टिफिकेट्स आप बच्चों के लिए यूज कर रहे हैं, जो आप अपनी सर्टिफिकेशन यूज कर रहे हैं, दे हैव टू बी वैलिड. कभी भी अपने आप को जो है ना मिसरिप्रेजेंट नहीं आपको करना चाहिए. यू शुड ऑलवेज मेंटेन प्रोफेशनल कॉम्पिटेंस. यू शुड नॉट मेक अनसब्सटैंशिएटेड क्लेम. ठीक है. उसके बाद आपको हमेशा ये बात याद रखनी है कि आपको इन्फॉर्म्ड कॉन्सेंट जो है ना वो साइन कराना है, विच मीन्स कि जो भी आप उस क्लाइंट के साथ काम कर रहे हैं या जो भी आप उसको थेरेपी दे रहे हैं, उसका एक इन्फॉर्म्ड कंसेंट जो है वो होना चाहिए. और उसमें आपको इन्फॉर्म्ड कंसेंट के साथ जो है ना आपको ये बताना चाहिए कि भाई इस ट्रीटमेंट में हम ये करेंगे और इसके ये प्रोज हैं और ये कॉन्स हैं. और जो कई दफा जो बड़े, अब मेरे पास काफी ऐसे बड़े क्लाइंट्स हैं जिनके साथ मैं काम करती हूँ, तो दे आर देयर ओन गार्डियंस. लाइक आफ्टर 18 एवरीबody इज देयर ओन गार्डियन ओवर हियर until and unless the parents they go to the court and they take the guardianship. So I have to explain the behavior plan to them, and then अगर वो consent करेंगे तो then we can do that treatment with them. Otherwise we can't do the treatment with them. So we want to make sure that they consent to the treatment. They understand what you're working with them. Especially हमारे जो Down syndrome के बच्चे हैं, जो cerebral palsy वाले बच्चे हैं, थोड़े intellectual disability वाले बच्चे हैं, they do understand that what are we going to work with them. And I had like almost 30 clients at one agency, and they all used to talk to me and they used to gossip with me, and we used to go over, okay, I'm going to do this plan with you, and they understood it. और इसी तरह से हम behavioral contracts करते थे. कुछ जो बहुत severe होते हैं उनके लिए फिर आपको उनकी family से, caretaker से, guardian से consent लेना पड़ता है, उनको बताना पड़ता है कि हम ये procedure करेंगे, and then you go from there. सेकेंडली आपको ये मेक श्योर करना है कि आपने जो भी उनसे कंसेंट लिया है वो वॉलंटरी है, विच मीन्स कि आप ये नहीं, आप उनको कोर्स नहीं कर सकते कि अगर आप ये नहीं करेंगे तो मैं आपको छोड़ दूंगा, मैं आपकी ट्रीटमेंट नहीं करूंगा, क्योंकि दिस इज समथिंग दैट यू कैन नॉट डू. Confidentiality, now this is another thing, so make sure that whatever is being told to you by the parents, by the families, by the caretakers, even by the therapist, sorry, by the client themselves, is confidential. You cannot share it with anybody. Unki pictures, unki videos, unke notes, unki reports, आप किसी से share नहीं कर सकते until and unless you have permission to do that. So अब कई दफा ऐसा होता है कि I used to work with this client and she had bipolar disorder. And she would tell me things about her mom, but I couldn't just go and tell her mom that this is what she's saying, because उससे फिर उसका behavior trigger होता था. And you know, but we would talk, we would go out, we would have lunch together and things like that. And I made sure that मैं उसके confidence को, उसका जो confidence उसने मेरे ऊपर किया है, तो उसको मैं I don't want to betray it, right? Same with the mom. You know, if they have any kind of paperwork, if they have any kind of like reporting, something like that, I cannot share it with anybody. I want to make sure that it is very confidential. I cannot take their name. So अगर मैं किसी से बात कर रही हूँ तो I always say कि oh, this client has this problem. I never take their name out in public. I can always discuss with names ABC. So we have to be very sure about that. लेकिन for example, if there is a client that says that I am going to commit suicide, that is something that you can always, you know, talk about it, and you can say, okay, now this is a very, very dicey situation and a very abusive situation, or, you know, they are at risk, so I have to do that. Secondly, अगर आपको ये लगता है कि कोई client ऐसा है जो कि abuse हो रहा है, जिसको सेक्शुअली फिजिकली जो है अब्यूज किया जा रहा है, तो उस क्लाइंट की जो है ना आप डिस्क्लोज कर सकते हैं, बट अदर देन दैट यू हैव टू बी वेरी केयरफुल अबाउट इट. सो व्हेनेवर यू आर वर्किंग विद एडल्ट्स, you have to keep into consideration the things that are going to come along with it, which is sexuality आ जाएगी, violent behaviors आ जाएंगे. The way that you treat adults is totally different than the way you work with kids. ये बात हमेशा आपने याद रखनी है, क्योंकि जब आप छोटे बच्चों के साथ काम कर रहे हैं तो आपका रवैया टोटली डिफरेंट होगा, लेकिन जब आप बड़ों के साथ काम कर रहे हैं तो यू हैव टू वर्क विद देम in a very, very strong, you know, like it has to be like more of a friendly manner, like a companion manner, and you have to treat them with respect. You have to give them dignity. आप उनको ये नहीं कह सकते अच्छा ये तो इसको तो कुछ पता ही नहीं है. This is something, and you can never use words like crazy और ये तो dumb है, इसको तो कुछ पता नहीं है in front of them. So you have to be very, very respectful towards them, because usually ये होता है कि मुझे ये बात पता चलती है कि फलाने थेरेपिस्ट ने जो है ऐसी बात कर दी, फलाने थेरेपिस्ट ने ऐसी बात कर दी. So these are the things that we cannot talk to our clients at all, because what's going to happen is that they are going to start feeling bad about it, and this is going to affect them, and this is not the way that we can work with them. So we also have to protect the dignity, health and safety of our clients, and we have to honor their choices. So उनकी जो भी choices हैं, अगर वो कहते हैं कि मैंने ये वाला procedure नहीं करना, so you cannot do that procedure, and you have to honor their choices. You have to give them adequate space for privacy, and you also have to look beyond the disability and treat them with respect. You also have to advocate for the clients. Is the problem amenable to behavior treatment? You want to make sure that you advocate for your clients. Koi problem ho, kuch masla ho, you are the ones who are the biggest advocate for your client. And when you're advocating for the client, you also have to see कि आप different doctors के जब जाते हैं तो आप उनके साथ जाएं, आप ये देखें कि जो medication वो दे रहे हैं वो सही दे रहे हैं, गलत दे रहे हैं, उसके बारे में research करें, उसके side effects को देखें, और उसके बाद जो है कोशिश करें कि behavior therapy से जो है वो आपके behaviors जो हैं वो कम होने शुरू हो जाएं. Always make sure कि आप scientific method को use कर रहे हैं, which means that you should go and you should research what are the scientific methods that are out there, what studies can be replicated, you know, for your clients, right? And that's what you can use. Or conflict of interest. Always make sure कि जब आप बड़े clients के साथ काम कर रहे हैं, तो जब आप उनकी families के साथ in touch आते हैं, या sometimes आप this is also another issue. Make sure you don't make dual relationships with them. So we've had a situation which is make a so we, I mean, I heard of a situation where there was a therapist who had a little bit of special needs, and then there was another therapist. When they come in relationship to each other, you know, they started dating, which is fine, but I don't like dating at workplace at all. And secondly, you cannot have relationship with their families, with them. It should be strictly professional. ये ना हो कि आप जो है उनकी फैमिली से रिलेशंस बनाएं, उनसे प्रेजेंस लेने शुरू कर दें, उनके साथ बाहर जाना शुरू कर दें, उनके साथ लंचेस लेना शुरू कर दें. That is totally against the Board of Behavior Analysis and the International Behavior Analyst Board. So that's about it for ethics and dealing with adult clients. Any questions?
Ma'am, do you know any center in Pakistan who is dealing with adults?
हाँ, कुछ है. जिस तरह इस्लामाबाद में अभी एक खुला है, असद ने खोला है. he was from basis. उसका नाम क्या था? काशिफ, do you know the name? जमजम भी है, yes. And असद के सेंटर का नाम क्या है? I think it's yeah, Asad has a center. I totally forgot the name. Just give me 1 second.
Transition Center.
Transition Center, yes. Thank you, Bushra. Transition Center, Zamzam hai. These are the two that I know in Islamabad. Other than that, I don't know any centers. I think there should be more centers. Actually, I wanted to open one for adults in Islamabad. But अभी मेरे और इतने मसले उधर चल रहे हैं for Pindi branch and Lahore branch. So I want to fix those first and then I'll go towards the adults. All right. Any other questions? You guys are good?
Yes, ma'am.
Okay, I'll send you the recording and inshallah I will see you on, I'll send you for the next one what time, okay?
Okay, ma'am.
All right, ma'am. Thank you so much.
Allah Hafiz.